Let's bring in ABC News medical contributor Dr. Alok Patel to talk a little bit more about this. Dr. Patel, based on what you heard there from Mary, how concerned should we be about the president's COVID exposure?
Well, Diane, it's good to be here with you. And I think in general, we have to be concerned about this level of exposure around anyone who is high risk. And we know with the president's age, he falls into that category. Now, one thing that is reassuring that we've heard is the overwhelming majority of people involved in these events, people who are around at the White House, at the Capitol, whether it is at that black tie dinner or when the bill is being signed, are not only fully vaccinated, they're also boosted. And we have to understand that these individuals are probably getting tested more and more regularly than the average citizen. And many of them are testing and saying that they are asymptomatic, which makes me wonder how many people out there have gone to an event, have been fully vaccinated, and haven't gotten tested because they were also asymptomatic. So I think it's fair to be concerned, but it's also fair to be a little reassured that the president has incredible medical care around him and is fully vaccinated plus boosted.
So what are you looking out for as we get more updates on this outbreak from Washington?
I think one thing that we're looking at right now is what the trend looks like, not only in Washington, D.C., but in New York City and other places on the East Coast where BA2 is ramping up. Obviously, all of us are crossing our fingers and hoping that everyone exposed remains healthy, remains mildly symptomatic. But I think one thing that's important that we keep discussing is that even though many people around the president tested positive, we need to remind people that a lot of them, if not all of them, are going to remain asymptomatic and do completely fine because they were vaccinated. We need to make sure that the headlines include the fact that just testing positive does not mean that the vaccines don't work. Preventing that severe illness is a proof that the vaccines work, and that still needs to be the main story here.
All right. And Dr. Patel, this week, the FDA's advisory committee started discussing the potential for new shots that target multiple strains of the virus. So what does that mean for people over 50 who are eligible for a booster now, and they're debating whether or not to get that second booster?
Well, I can already tell you, Diane, that people who are in that 50 to 60 range who don't have underlying medical conditions are just a little bit more confused. And what this might mean is that many people out there need to just hang on a little bit more and follow what the FDA is talking about. But I do appreciate the fact that the conversation's happening in terms of, does there need to be another booster in fall? Do we need to start talking about a universal coronavirus vaccine that targets more than just one strain, similar to influenza? And also, this might change kind of the strategy for some people out there in terms of how they're going to wait. If cases are low where you are and you're relatively healthy and you feel comfortable, you've gotten your third shot, and you're in that 55 to 60 range, it might be appropriate to wait a little bit longer to look to see what cases do. But anyone out there who is above the age of 50, who falls in this category, who's high risk, we know at least right now that the data does support getting a second booster and that it's going to be safe. There's just going to be a lot more data coming out in the future.
All right, Dr. Alok Patel, always great to have you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.